Rod Duff, your host.
And I'm producer Barbie.
And together,
we bring you our podcast,
Insights and Straight Talk. And with that, producer Barbie and I are out. Nice. Oh, shoot. I'm sorry. I messed that up. Hey, Dana, I'll get back to you. I thought I removed you off stage. Let me go through my monologue and we'll go from there. See you in a second. Good morning and welcome to Insights and Straight Talk. You can tell we are already having a little bit of a hectic day, but I'm Rod Duff here alongside, as always, with producer Barbie. Before we dive in, let me say this clearly, okay? Today's conversation is one that every single person listening right now will need at some point in their life. And I'm not saying that hypothetically. I'm not saying someday. I mean, literally, personally. Because whether you're healthy today, managing a condition, supporting a loved one, or doing an annual healthy checkup, right? We all are patients eventually. And yet no one teaches us how to be a patient. Stay with me. We're taught how to schedule appointments. We're taught how to fill out forms. Oh God, I hate that. But anyway, we're almost never taught how to communicate, how to advocate, or how to partner effectively with the people who are making decisions about our health. That's why today matters. Our guest, Dana Sherwin, healthcare executive, patient advocate, and creator of the Thinking Patient Framework. Neat program. Dana brings a rare, powerful perspective. She spent more than 3 decades inside healthcare systems, like hospitals, managed care, assorted consulting firms, and she's lived the patient experience firsthand while navigating a chronic illness and a stem cell transplant. And somewhere along that journey, Dana recognized a truth that should stop us all in our tracks. People who are engaged in their care consistently experience a better health outcome. Stay with that for a minute. And it's not because they know more medicine, but because they communicate better. Today, we're going to talk about what that actually looks like in real life. How do you prepare for doctor visits when time is limited? That's a big one. I mean, we all deal with that. How do you ask better questions without feeling intimidated or dismissed? Different personalities especially. How do you participate in shared decision making, especially when you're seeing multiple specialists? These are challenging moments here. I mean, think about it. It's just something we don't really process. How do you stop being a passive passenger in your own healthcare journey? And this isn't theory at all. This is practical, actionable, and immediately useful. Before we begin, I also want to recognize the organizations that help make conversations like this possible. The Mangum City Library. Thank you for standing for access, education, and informed communities. To Leaf Lab, thank you for proving that learning, when done right, equips people for real-world decisions, not just tests. And to our strategic partners, the Regeneration School Project and Voices at the Table, thank you for helping us build spaces where critical thinking, communication, and responsibility are learned early and practiced often. This show exists because of that ecosystem. And one more thing before we bring Dana in. If conversations like this matter to you, we ask you to support independent media by subscribing to our YouTube channel at Rod Duff 1939 and our Substack at insidestraighttalk.substack.com. We publish there 3 days a week. All right. Let's talk about how patients can stop feeling overwhelmed, unheard, or rushed, and start becoming true partners in their care. Dana, welcome to Insights and Straight Talk, where we talk deeper in subjects like this. How are you today, my friend? Why does that keep doing that? Hold on. All right.
Thank you, Rod. It's a pleasure to be here. I look forward to our conversation, and thank you for that beautiful introduction. I think that I have just accomplished a Train the Trainer program because you have the message. Thank you.
Yes, thank you. And I'm going to need you to kind of take over the first part of the show, because obviously our professionalism has taken a dive here for a minute. So I need you to kind of add that professionalism in here and make the show at least somewhat credible again. Please, people, what do we have? We have 200 people in already. My point being, okay, we do have somebody coming in today, so I'm going to take myself off. Why don't you set your journey, as we talked about in the green room? Set that journey that puts you on this journey, and let's have that discussion while we have a special young, brilliant mind coming in. He's going to help us do some stuff with the show, and so I'm going to say hi to him real quick. Start with your journey there, Dana, and make me look better. Really, I'm kind of diving off the deep end here.
I don't think it's not going to be hard to make you look good, Rod. First of all, I so much appreciate this opportunity.
That was good.
I appreciate the opportunity to talk with you and your audience about how important it is to be engaged in your care. And just to step back, so you know my background. So I was fortunate enough to grow up in sort of the middle-class suburb with a father that worked and a mother that stayed home. But my father was in the healthcare field and he loved his job. And he encouraged me to explore professions in the healthcare field. And once he brought me home brochures, and one of them was to be a dietitian, and one was to be a human resources administrator, and the third brochure was to be a hospital administrator. And I looked at that brochure and I said, I like to manage people and things. I like to make things work effectively. And it's sort of, in a way, a little laughable since I was 16 years old at the time, but I knew what I liked to do and what I was good at. So when I chose a college, I wanted to go into the healthcare field, but all the colleges I applied to were for graduate programs. So I went to college and then I went right to graduate school for a program in what's called Health Services Administration. This was many years ago, but in fact, it has been my career ever since I graduated from graduate school. My career has been in the healthcare field on the non-clinical side of things, whether it's operations or policy or analysis.
So Dana, if we could just kind of hover there for a second, as we talked about. When you said non-clinical side, obviously I've heard the term clinical throughout my many years out here in the world. But can you what does that look like? Non-clinical versus like surgical, I think, is where you kind of went through real quick, but I wanted to stop you and pull you back.
Okay. So basically, the healthcare system whether it's a hospital or a physician organization or a managed care or an insurance organization, these are big, usually very large enterprises. And then the clinical component is where people have to be licensed and credentialed, whether you're a doctor, whether you're a nurse, whether you are a physical therapist, occupational therapist. So those professions are on the clinical side of actually care delivery. And then there's the other side of non-clinical. Somebody has to run these organizations, the operations, the IT, the human resources, the actually communication with patients, the patient flow, the patient experience, all these things that are not medical professions and all.
But the infrastructure, you're talking about the infrastructure now here to all of that supports the clinical. I mean, you can't have the clinic.
Yes.
It'd be a mess, right?
Absolutely.
You've got to have that. Okay, I got you. Go ahead. We've got well over 300 people here, by the way, now.
access to care for people,
Okay.
improving a patient experience. How could we do things more effectively and efficiently to deliver that clinical care to people? And that has been sort of the thrust of my career in many different kinds of healthcare settings. I worked in hospitals, I worked for a hospital association, I worked in managed care, I worked for consulting firms. And there were so many things that I learned, and I was very dedicated to my profession because it was my way to do a socially conscious, what I thought was a very important thing to do. But what happened to me, I realized happened to many people. I had a health issue that I didn't take care of immediately. I was raising a family, I had 2 children, full-time
Yeah.
job, house, like a lot of responsibility, and I just ignored different symptoms that were happening to me. And it took me many years and really a health incident that alerted me to the fact that I had a very serious diagnosis that I had to deal with.
Right.
And I was in the healthcare system and I had access to the best healthcare ever. And I did not use the system correctly. And then when I was diagnosed with a blood cancer disorder, which means that my bone marrow wasn't producing enough red, white, and platelets. And that was I had a genetic malfunction of my DNA, and it was not inherited. It's something that happened after birth, but so it was some environmental impact to an already maybe defective part of my DNA. And so it's a rare illness, but not really. There are many people who have it, and there are some treatments. But when this happened to me in, I would say in 2003, I was diagnosed. There was no cure. There was no cure. I was able to function fairly normally, but I had to be monitored very closely. Until about 15 years later, my health actually crashed, and the only cure was a stem cell transplant. And that was in 2019, the year before COVID. And I put
wow. That must hold. That must have been a scary time too, because of COVID's differing effects in ages and specifically health. That's why elderly people or people that had chronic existing diseases. That was a scary time too, wasn't it? Not to divert, just to kind of take a little turnout and back on.
Yes.
That was a scary time, wasn't it?
Right. So it was only about 7 months after my transplant when I needed continual care. I was going to the hospital like every 2 or 3 days a week for many months, and then everything shut down. And so I had restricted access to follow-up care. And I had just been hospitalized the month before with pneumonia. And in retrospect, the doctors were trying to figure out, well, did I have COVID? What did I have? But I couldn't have had COVID because I wouldn't have been around here to be talking about it. And it didn't really come till a few months later. So it was a very arduous process. It took me I would say a good solid 3 years of heavy duty recovery, hospitalization, some emergency room visits in terms of taking care of my health. And through this process, I really wasn't feeling very good. And I really wasn't even thinking about, I just had to leave my career suddenly. I was not the same person that I was. I had to make sure that everything was going smoothly. I mean, I had enough wherewithal to take care of myself. So after about 3 years, I started feeling better. And one of my doctors said to me, you're a really good patient. And I said, what does that mean? My health is doing well. I'm recovering well. And she goes, oh, no, I don't mean that. What I mean is you come to every appointment so prepared. You ask us good questions. You're always on top of your own care and what needs to happen next. And we can really rely on you to work with us to be that good patient. And I said, doesn't everybody do that? And she said, no, people don't do that. And so I thought, well, maybe there's something that I know that other people don't know. And so she inspired me to start doing some research, thinking about it, reading research articles, reading books people have written on patient-physician communication and what makes a good patient and what patient contributes. And I learned so much in that process. I did start
Hang on right there, because now you're going to go right into the framework. I assume you started writing the framework, but before you do that, so what do you think it is? Interesting when you brought that situation up. I don't think I've ever had or heard of an instance where a patient said, my doctor or my assistant or whoever said to me that I was a really good prepared patient. Do you think that's because the healthcare system doesn't necessarily advocate for that? Or is it as much that the patient, unaware as we all are, learning from you different ways to approach it, but unaware currently where we are, don't do those things, and so the hospital doesn't have a reason to bring it up? What do you think's more the case? It's an interesting, it just popped in my head. Sorry to take you off.
Absolutely. Yeah. You put the finger on it. That is, nobody teaches you how to be a good patient, to communicate with doctors, how to take yourself on a health journey, or even if you're well. You need to be seeing doctors routinely. I didn't do that. I didn't have a primary care physician for my adult life because I was having children. I was seeing an OBGYN, not a primary care physician. This is not a good thing. So even I wasn't, and I was very knowledgeable about how the healthcare system works, but I avoided. But nobody teaches you these things. They don't teach you in school, in college, through your employer, through your health insurance company. Even your doctor's office doesn't teach you. And by the time you get to an emergency room or an inpatient admission for an acute condition, they're just taking care of the illness. No one's teaching you what you need to do to be a participant in your own health. And that's really what spurred me on. As I started reading all this research that was done, all this great information, I said, I never learned this in graduate school. I never, in all my participating in healthcare delivery settings, nobody cared about how to teach people how to be a participant in their own care. And I was reading things like they were doing studies, like you so rightly noted in the introduction. People who are engaged in their care have better health outcomes. And I started reading this research, and I've never heard it put this way, and I've never heard it. And I said, how come this isn't talked about? People who are engaged in their care have better health outcomes. And what do we mean by better health outcomes? Survival, cure, remission, less suffering, emotional well-being, pain control, functional ability and vitality. All these things are health outcomes. We want to make sure we improve our health outcomes. And just having this knowledge of better health outcomes really can help people. Like, this is important. This is something I need to learn. And the thing is, when you're sick or a family member is sick, you don't go to, Barnes and Noble or Amazon. I got to buy a book because I learn how to be a better patient. Nobody's doing that. So part of my message to healthcare providers, to employers, to insurance companies, give people this information to bolster their knowledge, their skill levels, their confidence. So important. Because little movement, little steps make very big difference. And once you really started a little bit communicating better, you just have that confidence to keep going. You do your own research, you find other doctors.
Just to add into what you're saying here, we do a lot of obviously health as part of not only mental but physical health, right? Because it's important, as you're saying. And especially as we get older in life. And I was talking, we had 3 days ago or 2 days ago, we had a doctor on that has a practice, and he specializes in menopause and premenopause. And we had a really interesting discussion. And it goes back to not advocating for your own health, because it's so important. And obviously being a man, have even less of a realization of this, but really you should start preparing in your like mid 30s and then into 40s, and then 51 is supposed to be that date, that age, where everything starts to transition. But, and I'll get back to my point here in a second, but the interesting about that whole conversation was that the most important part, especially of a woman, of all of our lives, but at that next level for a woman, is when they reach past that menopausal time, and now they're patriarchal. That's the part of the most important cycle. We always talk about young women and pregnancy areas and all that, but how important your health to be part of it, to be in that conversation, doesn't start way back either. It needs to go even at maybe not 20s, but 30s, 40s, all that time. That communication really creates for a better health outcome, and then preparing for things that make a quality of life, right?
Absolutely. It's so important. I would make the case for people in their 20s need to have an annual physical every year. If you have dermatological issues, if you have allergies, it turns out that like 50% of the working population between 25 and 55 have one or more chronic diseases. Now, chronic disease doesn't mean it's not manageable, but more than 50% of the working population have one or more chronic diseases. So it could be,
chronic disease defined as continuous, right? Isn't that the difference between the two? Tell us those terms. What do they mean?
Okay. All right. So a chronic disease is something that's pervasive, that continues. And for some chronic diseases, there are treatments, and some chronic diseases, there are cures. An acute condition is something that's going to affect your life and safety in an acute manner. And that's why you either go to an emergency room or you go into or you're admitted into a hospital because you need further tests to then do that diagnosis. But usually, like, for example, people who go see a doctor once a year for their annual physical, they'll do, a glucose or a lipid panel, which will show, okay, where are you in your cholesterol levels and your blood glucose levels? And if they see that something's amiss, they'll make a recommendation. And you have to then adhere to some treatment regimen and monitor your condition to make sure it doesn't turn into something worse, or it's something you can just keep control over, meaning you might be a pre-diabetic. So you really have to monitor your sugar levels, and it's not a disease yet, it's a pre-disease. So that's the monitoring. And so that's, whether, let's say, you pull a muscle in your leg and that you're an athlete and you keep pulling that muscle in a leg, you have a chronic condition with that muscle in your leg. So it's sort of straightforward as that.
All right. And then continuing on with what you were saying, because you were talking about the chronic disease and then moving forward, continue with your point. And then I want to get to a couple of these questions because they're matching in real well with what we're talking about right now. Go ahead.
Okay. So through my research, when I found all these studies had shown that people who ask more questions, so you're in the doctor's appointment, you ask more questions, you have actually written down these questions to allow you to then actively participate, to react and interact with the doctor, that you have done some of your own research, but not in an overwhelming way. You've, just learned, like, okay, I'm having these symptoms. What could it mean? And you're sharing your story with the doctor. If you have a headache, and if you've been having headaches and you're not sure what's causing it, you keep what they call a pain journal, and you keep track of that. So by the time you get into this doctor's office, that you're discussing it in a very sort of straightforward, information-packed, concise way, that I've had these headaches for 2 months. This is when they come about. This is how long they last. And so you're taking an active role in basically being able to communicate, explain and communicate your condition to the doctor. These have turned out to be really important factors in the ability of people to then participate more fully in their care. They'll be more interested in understanding a diagnosis, understanding risks and benefits of treatment, sharing with the doctor what their concerns might be, sharing with their doctor what their goals or their priorities are. So the more someone comes prepared to have these pretty intense conversations with the doctor, not just sitting back like doctor asking questions, one word answers, that you're letting the doctor know who you are and what you're experiencing, it bodes very well for having the doctor get to know you more efficiently. And as it turns out, the research has also showed that 85% of the time that there's some new diagnosis, it's based on what the patient has told them, not based on a physical examination, because the patient is telling them all this information about what's going on with them, both physically and mentally, and even sometimes environmentally, and even sometimes financially. If the patient is very careful about how they're using their meds, because it costs them $100 a month, and so they figured, all right, I'll only take half. And that is very important information for the doctor to know, but many patients are sort of very embarrassed about maybe some of their decisions that they make and the actions they take.
So these relationships are typically, especially the more we age, these relationships they build, right? I mean, you typically, hopefully, don't have to go to different doctors at different, and I know the healthcare system gets a little wacky at times, so how do you get through and into that process? And then I want to get into this question here, but how do you get into that? Are you building so you're being prepared, you're working with this journal, I'm going to call it a journal, the framework, and you're organizing your thoughts and the next steps as it develops, right? Especially in a chronic situation versus an acute situation, although both of them obviously are shorter but the same. Are you building that relationship to get there? What does that look like from above? Or am I just more informed in doing it, but basically, like you said, research and all that's important, but doing everything on my own? Or am I then building that respect and maybe relationship with my doctor or my provider, whatever that is? And then now that's becoming easier and easier and easier, and more of a, hey, Charlie, hey, Dr. Suzanne, so here we are, and it becomes more of that kind of conversation. Do you believe?
I think it's parts of everything that you've just said. So when I started my journey understanding, what it is that I know or that I need to improve upon to improve my communication with doctors and be that better patient, be an engaged patient, I call it.
Right.
So my first thing was, what do they teach them in medical school? What do they teach them? And so I did some research about this. And so I learned a few things. The first thing I learned, which was a little disappointing, that only in the last 10 to 15 years have there been specific courses on communicating with patients in medical school. So if you have a doctor that's like over 45 years old, 50 years old, they've probably never taken a course. So maybe by sheer experience, personality, or whatever, they do a really good job at communicating. But the younger doctors, there have been courses in this. So I wanted to know, okay, what do they teach them? What is the structure of what they call it in medical school? The medical interview. God.
The medical interview. Okay.
That's
kind of like, it's like also known as in the business world, the onboarding process, right?
Exactly. Yeah. So there are 3 parts to the medical interview that this is what doctors are taught. The first one is making connection with the patient, this relationship building, making a person feel, comfortable with an introduction. I mean, obviously it gets easier each time, somebody you've had, more and more visits with a doctor gets to know
Absolutely.
you. That goes a little quicker, but still you will see with the best doctors, there's still that element of connection building at the beginning. Like, last time I saw you, you were this, how did this go? And how are you feeling? And that's all that connection building part. The second part is understanding the patient's story and the trajectory of their illness. And that's called the information gathering stage. And that's where the patient comes prepared and the doctor asks all these questions to see what's going on. Let me get out of the patient what else might be going on. And it ends up being a really important part of the process. This is like the bulk of the
100%.
process, this information gathering, because it's part of when you do the physical exam. Does it hurt you here? Does it hurt you there? Have you felt this pain before? Let me listen to your chest and let me see if I hear anything, but tell me, what you're feeling. So this is the second part, information gathering. And then the third part.
Hang on a second right here. Where I want to interject Clayton's question because it builds on exactly what you're saying. Because we all experience this and it's part of that not feeling heard and all that stuff. How can patients prepare questions when appointments are very short? That doctor comes in and asks all those questions you just said. Then he sends in the nurse to wrap it up and he's out or she is out the door. So put it in that framework. Just add that in and then continue on the next checklist.
Sure. No, that's really important. So
it is.
So first,
we've all been there. We've all felt this, right? It's like, and then you don't even think because you didn't prepare. You also lose time on top of it because you don't think about it ahead of time. But it came up. But by the time he or she was already gone, by the time you ask the question, and the nurse is going to maybe give you a slight answer because they're not allowed to, whether they know or not, right? Kind of thing.
Right. So the first part is obviously you want to write down your questions in advance. And when you get into the doctor's office and you have all the niceties, doctor, I just want to let you know I prepared these questions and certain of them are a higher priority to me than others. And you let the doctor know that you're ready.
Out of the start.
Out of the gate.
Okay, that makes sense.
And the doctor will get used to you and say, I got an engaged patient walking in. I'm looking forward to, this is a challenge. What questions are they going to ask me? But I think what's important here, like if you're meeting someone for the first time and you have 10 different questions because of this time limitation, which I'm so glad this listener pointed out, because this is the pressure. This is the pressure of the relationship between the doctor and the patient. And I have talked to people all around the country, and it is the same no matter where you go, whether it's a 10-minute, 15-minute, 20-minute. I mean, maybe you get a half an hour on an annual visit, but it's rare, right? So this is the pressure. So you come in prepared. The doctor theoretically should be very enthusiastic to your preparedness and willingness to say, hey, I really want to understand what's going on with me, and I have these questions. But the second part is you can say, look, I know we only have 15 minutes, but I want to share with you my highest priority questions. So you should already know in your mind, make a little check off. I must know the answer to these questions. This is my goal at this visit. I need to know the answer to these questions. So then you ask the doctor, then you say, I have other questions. How can I communicate with you in between our appointments? Because I still want to know the answers to these questions. And so that's really important. I learned this through my process as well. You can't accomplish everything, but the ones that you can't, you say, look, I have these other questions. Maybe even some people I know hand the list to the doctor and they review it really quickly and they say, oh yeah, good question. And they can answer them all really quickly.
Let me ask you this, because I've thought about this before. Does that take away a little bit or does it add? Because if you're handing them the list and the doctor's running through it, but you're not communicating it, is there any difference there? Just curious.
Yeah, I think it depends on the person and on the doctor. So I would start first. Okay, so I would start first with using your voice to communicate questions that are the highest priority to you. I think that's important. That's important. Okay, so that the doctor. Your doctors get overwhelmed too. And again, they're very time conscious. Like I know this person's a real talker. I got to get, or like if you hand them like a file, I did this research, tell me what's right and what's wrong. Doctors do not respond well to that at all. So understanding how this dynamic works as a patient coming in, you're more accustomed. You can really go with that flow of understanding what the physician needs to accomplish. because
Yeah,
they
yeah,
really, they do need to uncover what's wrong with you. And it's,
yeah.
and so they need to ask the questions they need to ask as well to uncover this. And that's like a very big part of the process.
All right, so we're
So
gonna
then,
jump. We're gonna pop in a little bit in here, a little bit in what you're saying, because you said this a little bit earlier, kind of. Michelle, it lines up perfectly into where you're talking now. I think that the lineup, that what they're asking is really dead on. I'm because a lot of these things I confront, especially now as I get older, it's more often, right? Michelle, what is the best way to speak up without feeling confrontational? And that's where you were just talking. So starting out, hey, I got these questions. How do you want to have, it's that building of that relationship, but it's also a difference in being confrontational or being an advocate, right? There's an advocate is excellent. An advocate going too far is confrontational. Where do you split that seam?
right. So I get a little, there's a little bit of vagueness for me with patient advocate, because usually connotes a negative situation. Like I have to stand
Exactly.
up
Yeah.
for myself
Yeah.
because
Yeah.
something's going wrong. I think you have
Right.
to go into it. How could we work together to make things right? So I don't have
The mindset.
so it's definitely a mindset, and it's also having that vocabulary so you can become comfortable. I've gotten this
True.
question a lot by really highly educated people who say, I try to talk to the doctor, and the doctor responds to them saying, well, who's the one who went to medical school, me or you? How come you're not listening to me? Tends to be the older doctors, not like the younger doctors who maybe have a more interactive, communicative kind of style. But if the doctor becomes confrontational in your best intention, in your best voice, and trying to, keep calm and being, a patient who you're demonstrating that you really care about working with that doctor, you've chosen that doctor for a reason to help you, right? If the doctor starts getting confrontational, I got this question and I've had to think about it a lot. And I said, look, doctor, I don't want you to misunderstand me. I have a lot of respect for you. I have a need to know the answer to this question. How best do you think we should go about doing that? Or maybe can you explain that in a little bit of a different way? I'm a visual learner. Can you draw me a picture? Can you point me to a website? I'm really interested in learning more so I could partner with you so I can learn as much as I can, so that I can, I really want to improve my health and I want to work with you to do that. So no matter what a doctor is saying in a confrontational way, that you have sort of a ready response in a really calm way. And I know that's not easy all the time, because it's hard being sick, and it's you're fearful, you have anxiety, you're frustrated, all these kinds of emotions come in.
Oh yeah,
But
of course.
when you have this knowledge, I call it, like, in a way, it's a communication skill that no matter what's going on around you, you can pull the knowledge, the language of who you are, what you want to accomplish. And so you have that always in your back pocket, and it becomes more of a natural thing. And the more you do it, the more natural it is. And the more you do it, the more confidence you will have. So that confidence comes out, and not haughtiness, or not, I'm not being treated correctly. You're not going to get the care you need if you're constantly going to be like demanding or complaining or whatever, because patients do have a very important role to play in their care. And it's not something that's talked about a lot. And that's, part of my message as well.
So let's ask you this. So David here is, I'll tell you what, these guys are really dialed in. I'm loving these questions, because I think every time I see one, I'm thinking, okay, I get that question. I've wondered that question. But David here, what questions should first-time patients always ask? We've talked about the outside, the general, building that relationship, all those things. But what are some specific questions? I got a really bad light shadow thing going on here. Specific questions should first-time patients ask?
Okay. Well,
I
for
love
me,
this question.
it's a fantastic question. And it goes back to, what kind of doctor are you seeing? Are you seeing a doctor for your primary care doctor for an annual visit? Sure. Are you seeing a specialist? because there is so much information on the internet, and it can be overwhelming, but you could actually just Google it or use your favorite AI to say,
Oh,
I
yeah.
am seeing my doctor for the first time. The doctor is a board certified specialist in this. I'm seeing them for the first time. What are the top 10 questions I should be asking this doctor to set a
And
date?
this is why I'm seeing him for, and this is what I'm seeing him for. And that's an awesome
Yes.
tie-in, because there's another reason to start using AI to improve your life, because it's coming. There's something that if you don't use it up to now, type that simple question in there.
Yes. And then the other thing is that most major academic medical centers across the country, and there's good ones in every single region, if they have a department on that specialty that you're seeing a doctor, let's say it's, diabetes or a lung issue, then you go to that department on their website, and many of them have questions you should be talking to your doctor about. This is most prevalent in the area of cancer diagnosis. There's a huge amount of information on websites, whether it's an academic medical center or whether it's a disease-specific website. There's so much information that there's basically no excuse not to prepare questions in advance of an appointment.
Oh, sorry. I have a new producer, by the way. Shout out hello, B, if you would. Can you hear me, B? I was giving him some instructions, and you cut that a little short on me, and I mistimed that. Earlier when we were in the green room, I talked about how important it is that I have this thing about conversation flow, and I have not helped you at all with that today, have I? I've just been totally destructive on that today. It's been an amazing day. Damien asks here, what's one mistake patients commonly make with doctors? I love the way this is going around here. I love this. So, Damien, how would you answer Damien? Great question, Damien.
I love this question, and I can answer it in a few ways, but lately I came upon this one. Well, there are two. So one mistake is to withhold information from a doctor because you don't want to let the doctor know how much you drink, smoke, do drugs, sexual activities, other things. You really need to know what's happened.
What's in there?
Latest in your life.
What's going in that body of yours?
It's a really important thing, and many people do withhold information, particularly like if they're seeing a doctor for the first time. They feel like it's sensitive, it's confidential, but the whole medical appointment is a confidential process. But really, if you want to get to the root of something faster, you should pour it out. And, obviously in a very concise way, this, and this, let the doctor ask you any follow-up questions if necessary. But the second way I would answer this question, which I just came up with recently, is the mistake people make is that they don't ask doctors the question that they are most afraid to ask. What is the question you're most afraid to ask? You think about it in the days before your appointment, and you write it down, and you make sure you ask the doctor, like, what could this mean? What could these symptoms mean? I mean, I'm guilty of this, and I've been doing this now, like this focused work, for about 3 years now, and obviously have been a patient for over 20 years with the chronic illness. Right. And I just was so afraid to ask certain questions because and usually you're afraid because you might have a family history. I had a very broad brush family history of all kinds of diseases and really devastating and sad kind of things. People that I know, and because I worked in the healthcare field, there were always stories about what happened to people. And so I never wanted to be sick. I just chanted that in my head from the time I was in my 20s. I can handle everything, but I can't handle being sick. I don't want to know. I don't want to know. And that's why I put off my care. And if I would have known, and it's why my children have benefited greatly from my newfound wisdom about taking care of your health, because nobody talked about it. Nobody talked about how to be brave with a doctor. Yeah, they're a doctor. They went to school for that. You may not be a doctor, but the interesting thing is doctors sometimes complain when they're patients with other doctors because other doctors think that they don't have to explain things as much because they're patient as a doctor. But the doctor who's the patient might have an expertise in something totally different. And so the doctor patients complain about the doctors who are treating them, not giving them all the information. So many people are intimidated by doctors, or again, the pressure of the appointment time, or stories that they've heard about other people on how doctors have treated them. But the thing is that you have to know what's right for you, and you have to acquire the right skills and knowledge and mindset to be able to do all these things.
I don't know if there's an actual statistic on this or anything, but what do you think? You always hear about men that never want to go to the doctor, right? So that's what creates this pop in my head. What do you think, like, people who are afraid to ask the most scary question about something, you think that's more from women or more from men, or is it pretty equal? It's a personality thing, and obviously it's an uninformed thing. That's what we're talking about.
Right.
Because when you're informed, the scare kind of goes away. I mean, it does.
But
what do you think? Is it more men or women?
I don't really know. I think it's more like your who you are as a person, your personality. Maybe
that's what I figured.
It has something to do with how you were raised, whether your parents were hypochondriacs or not, or like people who are.
I'm a hypochondriac, no doubt about it.
Well, then you get the care you need, because everything that bothers you get the care you need. So
yeah. And you know what? It's funny because you said earlier, and sorry to cut you off there, but you said earlier how doctors are the worst patients to have because they're doctors, but they may be in other things. But one thing I've really discovered is you're not always correct or any of that, and doctors go for a reason. But you know what? You know your body better than you think you do, than you give yourself credit for having. Like when something is going on, now if it's one of those things that it's here because it's connected to this, that's connected to that, that's coming from here, obviously that's another thing. But a lot of times, I don't think we trust ourselves with, hey, something's up here and I want to know, let me do a little self. And for hypochondriacs, I could probably even get better care if I did that research, or when I do that research, because now, that's just a whatever, or that's something there. So it's interesting how these lessons can affect the care on both sides. I want you to read this one right here. Out loud. Come on. Share
want me to read it? Want me to read it?
I want you to read it out loud. The next two, actually. This one and another one.
Great show already. Such an important topic.
Thank you, Clayton.
Thank you.
Yeah, absolutely. Yeah. And Michelle, she's got something to say here to you.
Amazing insights, Dana. Learning a lot live. Thank you. Means a lot to me.
I think you talked about interacting with people and doing doing this advocate work as you did for yourself, as you developed for yourself. And then on top of this now, that's one thing I really love about this show. That's a really big thing that I love about the show. A couple of different people have told me, you know what, Rod, you're the luckiest son of a gun in the world. I said, I know I am. Expand. He goes, you know what? 6 days a week, you get at least, by the way, we're at 50 minutes. Are you okay? We've got probably about 4, 5, 6 questions more, something like that. Okay, you're good. So at the end of the day, these people are saying, 6 days a week for at least an hour a day, you get this expert advice in all these different topics, and you get to see them from different angles, different lenses. For instance, we're talking about advocate care. The doctor we were talking about, is more specific, right, to what we talked about as women get older and go through. And that was a real interesting conversation, but it was a completely different. It was still about being an advocate, being knowledgeable and being aware, but in a different aspect. And I mean, we talked about lifting weights for older people is probably muscle building is one of the most important things in your life. So we talked about different things. So it's fascinating. And here we're talking about advocacy, and we're talking about how to just and it's not a lot of effort, is it? I mean, all you're doing is you're doing something that's should be one of the most interesting parts of your own life, because it's your own health. And it's quality of life. And you tie all these things together. And I'm such a lucky person, because although our audience, same thing, but I get it every single day from every single one. So I'm really, I can't argue with that. But how do you handle conflict advice from multiple doctors? So you have one doctor saying one thing. And I have a friend, a digital friend. She comes on quite often. She's a creator. She lives in South Carolina or something. But anyway, she has the same thing. And it's a knee thing. And it's her traditional doctor, her surgeon doctor, kind of knee person, whatever. I'm sorry, I don't know the term. I'm going blank. Versus a stem cell doctor. And she's getting, now that's a little more extreme, but even within your own ecosystem, this happens, doesn't it? You get conflicting advice from different doctors. How do you handle that? And what do you talk to them about it? Or are you going to get in trouble because Dr. Joe is disagreeing with Dr. Sue? You know what I mean?
Right. So I do think there are in many cases, it's important to get second opinions. So you get a second opinion and maybe different from another opinion. But doctors, this is it's a medical standard. It's okay to get second opinions. Your insurance pays for second opinions. It's important. So whether the doctors then end up talking to one another, or you may even see a third doctor. I have experienced that when there was something wrong with one of my labs and I wasn't really getting the right answer, and I was doing some research online, I said, I got to explore this on my own. I want to see an allergist immunologist. And I went to that person, and that person gave me a whole new set of facts, and also like alarms, set the alarms with, well, your hematologist oncologist should have been talking to you about this because I think they missed this. Wow. And I went back to the other doctor. So it's okay. And again, the more you really, I call it being the CEO of your own health, the more you take charge of your information about you, your health. Again, you're not the doctor, but you're taking charge of your own health in terms of understanding to the best of your ability information related to your diagnosis, to your treatment, to your medications you're taking, to follow up, to monitoring things that you need to be doing for your health. The more you take charge of that, the more you can go in a way from doctor to doctor, talking about issues you have on your mind that may be conflicting from doctor to doctor, but it helps inform the situation. And obviously, eventually you have to decide, well, which option do I want to go with? So sometimes it's just a matter of what the doctor's experience has been with other patients and what they know about certain treatments, and they partial to one treatment over another. But it's up to you as the patient to go figure out this information, because they're not going to say, oh, I do it this way because, you can ask them, I do it this way because I've had experience. This is a tried and true method of doing it. But then you go to another doctor who says, this has helped. So it's a new treatment. It has helped so many people. I think in your case, based on this, and this, it's worth trying. And then it's up to you to decide which direction you want to go in. And again, you can get, multiple opinions, but you have to make a decision, because you have to make a decision what I need to do now for my health. It may be something you can wait 6 months for, or something you need to make a decision pretty quickly about.
And you just talked about two different things here, and also emphasizing that second opinion. So two different things here. One doctor just disagrees about a diagnosis with another. So there's that discussion that needs to be had. But what you brought up just a second ago is also very, very interesting, because not all doctors are made the same, or not past experience or lived experience or education is built the same, right? because one doctor says this is the tried and true method. This works. We've had a lot of success with it, and we've got data on this and that. And then another doctor who says, you know what, that's great, but there's this new, and this is happening more and more in emerging science, right? We have this new ability. We have this new care. We have this new something different. And for your situation, this matches really well. That kind of information is good information to have when you're advocating for your own body, because you've got to actually consider newer things nowadays because they're more reality than what was developing, say, in the 50s, where there's still a lot of mistakes and all that kind of stuff, whatever. You know what I mean?
Absolutely. And modern medicine saved my life. So I'm a big proponent of exploring everything that's sort of new or newer. Like new is medical is like the last 10 years, but advances, clinical trials. I participated in many, many clinical trials because I tried to avoid having a stem cell transplant as long as I did. But the reason I think my transplant went pretty smoothly is because they came up with new medication regimens to prevent what they call graft disease and other things. And so me waiting, it advanced how medications were applied during this process. And I think it really was one of the reasons that I'm here today.
We're going to dive. That's awesome. And that's exactly that point of that follow-up. I don't think people do. I know I'm guilty of this. So I'm just, from my own lived experience, I don't think people do that enough. So we're going to dive a little bit into the mindsets here. So we've been talking about what you should do, how do you prepare and all that. But this question from Jason is interesting to me because I never thought about, I didn't think about it at first being a thing, but when you're shy, it's not so easy to have that communication just in everyday life, much less this topic. So Jason, thank you for this. How can shy patients build confidence speaking to physicians? It's like almost like a guy trying to go out on his first date and, shy to ask this girl out, kind of thing. So how do you answer Jason here? Or partner, I guess.
So I think there are multi-parts to this, and we'll talk about the multi-parts and then let's talk about the mindset thing. But the multi-parts is when you do prepare in advance, you prepare your story and you're confident with your story and you're letting the doctor know, and you could even read it off your sheet to get the conversation going. The doctor will see what you're doing. The doctor will ask you additional questions and the relationship will sort of build from there because you've prepared. The doctor knows you care about your health. The doctor knows what your goals, your priorities are. The doctors will see that you're trying. So you don't have to, it's not about being an outgoing person. It's about being prepared,
good point,
thoughtful, knowing yourself and knowing that the reason the doctor went into this profession was to be there to help people. And I know for me, when I've been so lucky, the most amazing, caring doctors. And it really helps when you have anxiety, when you know that something's really wrong with you and it's going to be a long process, to have somebody who is just like compassionate. You find a compassionate doctor, and sort of that comes out more when the doctors see, that you really want to take care of yourself. You're going to do everything to work with the doctor to take care of yourself and make yourself, have better health outcomes. So I think that's one thing that's like important to do. And also, again, doing, research before and after to find what don't I understand and figuring out what you can understand better, because knowing more does raise your confidence level. And I know shyness and confidence are two different things, but it's like they sort of work, it works together. You have confidence, and just because you're shy doesn't mean you can't communicate well. You may just say it in a different way. But it's about, this is the resource that you have in front of you, let's say for 15 minutes. How are you going to make best use of this very valued resource, this very expensive resource? I mean, I would say, like, say somebody who is shy, but is like a chess master, right? Put all that energy and effort and can have endless conversations about chess. Well, make yourself your most highest priority hobby.
Your own chess master, right? Your own chess master, right?
Yes.
That is beautiful. In a little bit different sense, though. So we're talking about the personality side of things, right? And you hear about this. I know there were Jeffrey Bowman. I've heard this study has been out for a little bit. You heard about it before, right? In your own health, a little bit different here. Not how to organize but how does mindset play in your own health? Now, granted, the more you know, I think the better your mindset is, one way or the other. Whether it's good or bad, your knowledge is powerful, very powerful in everything. And this whole show circles around that mantra of education. So what role does mindset, though? Do I feel good? Is my mindset positive? Is my mindset negative? And that can evolve with more education. But how does mindset play in your in patient outcomes?
Right. So I think this was probably one of the most interesting areas in my 3 years of studying this and developing resources for people to use, increasing people's skill level, is really sort of understanding the psychology of it all. And that mindset is, part of the psychology. And I didn't take really many courses in psychology, and I'm not a psychologist, so I had to learn like a lot, because I do think it's a very important part of this process. And when you talk about mindset, you could have a fixed mindset where things are what they are. I put things in and they are what they are, and they're very, stable, but they're very secure. Or you could have what is called a growth mindset. And people who have read Carol Dweck's book, was called Mindset. It was a very famous book published in the early 2000s. So growth mindset relates so much to being an engaged patient and engaged in your care, because growth mindset means you believe that your experience, your skills, your abilities, and your ability to deal with the ups and downs of life, that is changeable and it can grow. And that's why they call it the growth mindset. So as it relates to, healthcare, it means that you can continue to learn about your own health through practice, through learning new things. Even, I use this as a very small example, but learning the names of your medication, so that, like if a doctor asks you or a pharmacist asks you, you can just rattle off these names and what the medication is for, how much you're taking, whether it needs to be refrigerated, whether you have to take it with food. But you need to be able to have the language of your health, and being able to learn the language of your health helps expand your abilities to communicate about your own health and how your health might be changing and what you can do differently and what you need to learn more about. And so, it's available regardless of your health literacy, regular literacy, whether you've ever been sick before. Sometimes people have never been sick or have had no family members who've been sick. It becomes the biggest tragedy in their life to be facing like a new acute or chronic illness, and they think it's the end of the world. But there's so many opportunities to take care of your health and treat disease, and also monitor, if you're healthy, to monitor your health. And to, that's why people wear the personal wearable devices, because they want to track, how's my heart rate doing? How's my blood pressure doing?
I got it all right here, sister.
That's wonderful. That's wonderful. Even I wish I would have had, they didn't have the entire extensive panel of genetic tests that they have today, and I, pushing my own family to make sure they get these genetic tests, because I was very afraid years ago, but they're much more developed today. Like, I didn't want to know. Well, now I want to know everything, because I learned so much through my own health journey. I want to know, and it is important. Some people can't handle knowing whether they're at genetic risk for something. If you're at risk for something, heart disease, cancer, all the different things, that I think there are like a panel of over 100 tests on the most fullest span of tests, genetic tests. It's just things you need to monitor and be aware of. It's like it turns out my whole life, I never had high cholesterol. Well, because of my disease and the treatment, now I have high cholesterol. So I have to, make sure I have the labs and take care of it and look at the foods that I'm eating. I never had to think about like what foods I was eating, or I cared about nutrition, but I, had cared about weight control, but I never had to focus on, am I having too many sugars? Am I having too many carbs in my food? That kind of thing. Now I have to do that. And in a way, I'm happy to do that, because if there's something else I can do to improve my health and keep me on this side of life, then I want to, be on that path.
Producer Barbie, if you're familiar with the show, you're familiar with that name and that person, I should say. She's had a very interesting health journey. Very, very, very fit, very athletic, very active person because of diabetes from a young age in her history. But you talked about that panel of over 100 tests that you can have for genetic issues. And that's something that's really interesting. And I only bring it up about producer Barbie because she had this situation, and it was a gene that's passed down through generations, but only every once in a while people get it. And it's a gene that apparently you can get, I think it's cervical cancer and breast cancer extremely easy. And you literally have to have a hysterectomy to so there's the sooner you know about things. The reason I bring it up is in the beginning of that journey of hers during that time, she spent a lot of time in avoidance and not wanting to know and afraid of what that situation is and the effects of what she would have to do to not accommodate the disease, but to deflect the disease, which is a serious operation, obviously, right? But her and I went through this journey together, meaning I didn't go through it with her, but I talked to her a lot about it. And it was a constant battle to say, hey, look, information's, I'm with you all the way, right? And at the end of the day, something's going to be known, and you should know that, whichever way it is. And eventually, her life became a whole lot better because there was also the stress of not wanting to know. So this is a very real thing, even especially in the genetic thing, because you don't know, and it's another level of stress. I want to bring up what Ichel's is talking about here, because it's the other side of what you've been talking about. This advocate, I shouldn't say that. The studying, the work, the knowledge, the finding out, like the example I just gave with Bart. There's a lot of still, like you said, do the work. There's a lot of work in things. So how can chronic illness patients not burn out? I mean, avoid burnout in advocacy, because that can be a little exhausting. It depends, but it can, right?
Absolutely. And I'm assuming the advocacy
Michelle
is self-advocacy that she's talking
about. That's a great point, because then there's also caretaker burnout.
Right.
Hit both those. Assume both.
So for patients.
By the way, can you believe we've already been going an hour and 10 minutes? You okay still, right? We got,
I'm okay.
10 more questions came in, so we're still at about half a dozen.
It's all good.
All right, go ahead.
So I experienced this as well, because you have to be constantly doing self-care management, or if you have a caretaker or somebody who's helping you, it's really a lot of coordination, a lot of doctor's appointments, and a lot of, following, monitoring, making appointments, all the things with insurance, all the things with medication. I totally understand this, and I went through it. I think that there are a couple of avenues that help. I don't know if it avoids it, but it makes it better. It makes burnout less, ameliorates burnout, and that is joining patient communities or support groups.
Yes.
And I did not do that at the beginning, but I ended up doing that. Maybe it took me 2 years, but I was really sick for about 2 years after my transplant. So I didn't really want to talk to anybody. But once I started waking up, I said, this might be a good thing for me. I'm feeling like the stress of leaving a career. I'm feeling the stress of like, what's my life going to be like in the future? How long I'm going to live? All these kinds of things. That being part of patient communities, whether it's support groups, so most big disease categories have patient communities and resources for patients, and a lot of them run, and particularly, since COVID, they all still run support groups on Zoom. So I would see what types of support groups are available. Sometimes local community centers.
For either way, there's support. Yes. There's the provider. I'm sorry. When you're supporting someone else, there's support groups for that, and then there's support groups for yourself as well.
Right. And what's really nice about the patient community, so a caregiver, I think, could go to any caregiver kind of group, right? Yep. But for patients to be with other patients who have gone through similar things, I have been part of support groups for people with my disease, myelofibrosis, and I have and then people who have had stem cell transplants with myelofibrosis, or stem cell transplants for any kind of blood cancer disorders, because there are many different kinds. And I found great comfort in talking with other people. And a lot of these groups are led by very experienced social workers or nurse care managers, and you learn a lot about the process. And like you said, Rod, knowledge is power. It makes you feel better having that knowledge. And it's not like maybe you're not in as control as much about what's going to happen, but you figure out like the right questions to ask, and it soothes you to know, okay, this is the course that I'm on. This is how other people have gone through it. You get like encouragement and inspiration for other people. I mean, I've been bowled over by some of these support groups that the people tell me, who are even people who are sicker than me, that such a love of gardening, they had to get back to the garden as soon as possible. And I've spent like 3 years indoors, taking care of myself. And these people like, I got to get out to the garden. I got to take that hike. I got to go climb that mountain, whatever it is. And those people, very inspirational to me. Yeah, they were even sicker than I was, but it was like the thought and the knowledge that people fight, how people fight for themselves and how people fight to have a quality of life is just so inspiring. And particularly, obviously, chronic diseases can be so complex, and you have to know so much more than just like a more simple kind of, disease that you do this treatment and the thing goes away. But I think it's very inspiring to have communication with patients in similar situations.
Well, you just touched back a number of questions ago, because that goes back to also adding to your mindset. I mean, that inspiring, somebody that wants to get out to the garden or go take that hike. First of all, those things have to be good for you, especially if your body wants that to happen. And all that we know about staying active. And I mean, after surgery, you're supposed to get up, or like the next day or that night or whatever, get up and take a couple steps, even no matter what it is, just to get the body moving again. So that mindset, now we've double answered a question a little bit ago. These next couple of ones I want you to read for me. Would you read what Jason says on the screen here?
Thank you for breaking this down so clearly. My pleasure.
And then David.
Okay. Powerful and practical, great session. Thank you so much.
I love what's kind of flowing out here. What questions improve trust? So we've asked a lot of different, how to build confidence, how to get around shyness, these different things, how to not be rushed, how to become noticed. But this is a great question, because this is about, okay, what questions? I think I'm assuming Bradley is talking about his trust, in his case, his trust towards his doctors. What I'm assuming he's giving out there.
All right. Well, this is probably too complicated for me to answer off the top of my head. However, I think when the doctor sees that you are asking these questions in like a second session, the follow-up is like that they see that you're trying to either understand it more deeply, or another issue has been raised related to
It's
it.
not just random. It's not
It's
just
not
random. It's
repeating it.
coming educated.
Right. The patient is becoming more and more educated. As I said, this has been my experience, and the research has proven it. Doctors respond more enthusiastically to people who are engaged in their care. So the questions you ask, even if they're incremental or just touch upon like superficial knowledge, but the next one asks a question that not only is relevant, but the doctor says, "Oh yeah, I should have told you that too." Then the trust is really built, because the doctor's being honest. Yeah, I should have explained that a little better. So you're helping the doctor see this, and yet you're gaining like, wow, oh, I asked a good question. Oh, I'm glad I did. Not like, oh, the doctor didn't tell me. No, the fact is this needs to be an iterative, interactive relationship with the doctor. Again, patients have a very important role to play in understanding their health and what's needed.
That is that is so on point. And expanding on that. Okay, so now this is interesting from Paula. How can employers support better? Employers support. So do you work with employers? What does that look like?
Okay, well, it's definitely an aspiration of mine to work with more employers. I
Yep.
have been a speaker at conferences that are for employee benefits kinds of conferences, to share what I think is the art and science of what should be taught to their employees, not just like, here are your benefits, but how you actually use them, how you access.
Because that's what usually happens, right? I mean, there's a little bit of using it because they're selling the service is within the thing, but they don't really do that, do they?
No, well, no, because it's sort of the way most sort of the HR component is structured these days. There's a department that helps to build and negotiate the purchase of health coverage for the employees and what's included in that, right? And then there's a part of HR that might be even a health and wellness section, which may be, special perks or gym memberships, or a little a seminar on menopause, or a seminar on weight reduction or anti-smoking kind of stuff that they do. And then there's a third component that people may be familiar with, called employee assistance programs, EAP, employer assistance. So those three separate components, when I go and speak on this issue, there's definitely a gap in between what they provide their employees, but there's no investment in helping people use these services more effectively and have better communication and better ability to navigate the healthcare system. And so this is part of, my sort of, career journey right now. My focus of my work is to get this message out and have employers have programs in place, whether it's workshops or resources, or included in an orientation program, how people can navigate the healthcare system better, communicate with better doctors, be more engaged in their care for better health outcomes.
Well, I had mentioned to you earlier on, or back in the green room, that we want you to put your contact. We got a couple more questions here, but before we get close, as I read this question, put your contact information as you're talking about it. Give me a little time and I'll copy and paste it over into the comment section. But Landrick, I love this. We've already kind of, I think, dealt with this. Thank you for putting that in. I'll hit that in a second. But let's for Landrick, let's pick it down. You have I shouldn't say this, a gun to your head. You can only pick one. What is one question that every patient should never stop asking? One question, just one, but take a long time to answer it so I can copy and paste.
I would say one question to always ask is, given my health condition and everything that you know about me, what should I do differently, do better, or add on to what I'm doing already?
That wasn't long enough. I'm halfway through. Hold on. Let me get down to here. So I'm going to have you read this, and then if you would, kind of from this, reading what Matthew, I haven't put it up yet. Or maybe you can see it. What Matthew has to say, but I want you to read that, and then go into you still have the same almost 400 people on the show. So this is a powerful message that I think a lot of people are, I like to say, hovering on. Because nobody's left. It's awesome. But at the end of the day, sometimes a conversation could be like, well, we're at an hour and 21 minutes and it starts to dive off, towards the end of it. I forgot there's a term for it in the industry. But anyway, if you would answer his, if you would read his comment while I switch that over, and then start your last word that you want to leave people with. I'll come back in and join you and then throw you in the green room and keep your hands off the peanuts. Deal? All right. That's the question. That's the comment I want you to read.
Fantastic show. Thanks for going live. Thank you. Thank you all for being here. So if I were to have a call to action to all the listeners and the wonderful discussion and the amazing questions today, I would say that the heart of everything is developing your own curiosity and care for your own health, because you have an important role to play. And so developing this curiosity and your own self-awareness, you can go from just being in a reactive mode to being in an engaged transformational mode. So it's really important for your own health and longevity to take care of yourself in this way and develop your abilities and your skills to the best you can.
That is perfect, man. I think we have something wrong here on LinkedIn. Does that look right to you?
Oh,
wow, they came together.
You need a space. So anyone can.
Well, no, but in LinkedIn, is it Dana? Dana E. Is there a space in that? Or usually isn't it all together? Maybe I'm wrong.
Yeah. So right. So I don't have the exact link.
Look it up on your.
Yes. So all you do is put it in the search bar. I'm the only Dana E. Sherwin. And
that's an advantage.
My moniker is "We are all patients." So you'll see that in my headline. We're all patients, and I've been writing weekly for about 2 years, all on the subject of how to be an engaged patient. So if
anybody, where do you find that?
Oh, on LinkedIn. So in my posts that I post on LinkedIn, so I write little. I do research on topics that I think are very relevant to being an engaged patient, and I basically do a little report or sharing of information, and some odd things that I do.
Like a blog? Like you do a regular blog?
Yeah,
Perfect,
like a blog. And so it spans over a 2-year period, and it definitely reflects. I see sort of my own trajectory. Yes,
Can I ask you something? Are you on X by any chance?
I am on X, but I don't use it. I don't post on X.
I'm only saying this just for you. Hey, audience, don't listen. Close yours. This is a private conversation. There's a prediction that X is going to become, well, it's already there, but people are getting back more into the blog. The video, the long form video that we have is an emerging thing, and it's this platform, but there's a lot of research coming out now that people are also really getting back into writing. So X is becoming a very important platform. If you're posting, you might, and LinkedIn is equally important. I study all this stuff. As much as you study patient advocacy, I'm doing that, studying on this kind of stuff. So I've just, as a side note, suggestion, audience, you can listen back in a second. Start posting on X too, just for your own good. I think you'll see a big rise, especially if they're posts. I do a lot of videos there, but my posts, people read them all the time. You should check it out. So give everybody a big wave. I'm going to throw you in the green room, so to speak. I'm going to wrap this up, and then I'll come back and meet you there in a couple minutes, okay?
Thank you so much.
All right, see you, bye. See you on the other side. All right, as promised, a beautiful, beautiful show about obviously a very important conversation. Well, I should change. So that's her website. So you can contact her there. And then as she said on LinkedIn, this one here, I messed it up a little bit. I'm not going to go back and change it because on LinkedIn, she's the only Dana E. Sherwin. So hit her up there. But with that all said, I'm going to kind of shut things down here a little bit. And in so doing, I kind of, as we wrap it up today, I want to leave you with one thought, with this thought. Most people don't struggle in healthcare because they don't care, right? I mean, that makes sense. They struggle because no one ever taught them how to engage. And that's kind of what we've been talking about. What Dana shared today makes something very, very clear. I mean, reflect back. We go over this conversation because it's clear that communication isn't a personality trait, okay? It's a skill. And when patients learn how that skill, outcomes really start to change. This isn't about challenging doctors. It's about partnering with doctors. That's a concept I don't think we know enough about. It's about preparation, clarity. How do you get there? Clarity and confidence. So decisions are shared, not dictated. And that's kind of a key aspect of, I always talk about quality of life over quantity. And if you could have both, that's obviously the ideal situation. But to me, in my whatever limited knowledge, quality is really important. And it's something that's kind of becoming more and more important the older we get. So if you're listening right now and thinking, I wish I had known this sooner, you're not alone. But here's the good news. It's never too late to become a thinking patient. I strongly encourage you to follow Dana Sherwin's work and explore the thinking patient framework. We talked about that earlier. It's basically a journal and appointment book. Check it out. Check it out on her website. It's really cool. Whether you're managing your own care or supporting someone you love, this is knowledge that empowers, and empowerment saves time, stress, and sometimes saves far more than that. And you know what? If today's conversation resonated with you, please help us continue bringing these voices to the table. Subscribe to our YouTube channel at Rod Duff 1939. Join our Substack, InsideStraightTalk.substack.com, where we go deeper into these conversations throughout the week. 3 times a week we print there. And we'd appreciate your support in following us on X, Instagram, LinkedIn, and Facebook, all linked in the description. Independent media services because communities decide when it matters. I want to thank our sponsors and partners. Thank you for believing that informed people make stronger groups of stronger communities. To Dana, thank you for your work that you do and the clarity that you bring. To all of you, thank you for showing up curious, open, engaged. Until next time, this is Insights and Straight Talk, where real conversations matter. Stay through the outro, do a little goofy surprise or whatever. And with that all said, I'm Rod Duff. I'm your host, and I'm freaking out of here.
Before you leave, if you'd like to watch another one of the podcasts, click the first link in the description. We love having you here, and we appreciate all your support.
And with that, producer Barbie and I are out.